We're going to go ahead and get started here in just one moment. When you logged on, you should have had a little taskbar that popped up, and you should be able to send me a high five or raise your hand if you can hear me through the question and answers part on the taskbar. So I just typed a little message out saying that we'll begin shortly. If you see that, and if you can hear me and see my computer screen, please raise your hand. If you're having any difficulty with either hearing me or seeing my computer screen, please just type out a message and let me know. Okay, we're going to get started today. I'm hoping that everybody can see me and hear me. I didn't have any responses, so we're going to get going here. So I want to thank everybody for joining me for Hyperpigmentation, Combating This Difficult Skin Condition. This is a pretty intense PowerPoint presentation and webinar. It will be recorded, and you will be able to re-listen to it on our YouTube channel if you miss any part of it or you would like to share it with someone. So I will give you that YouTube channel at the end of the webinar today when I give you your discount for joining us today. Seeing all those thumbs up, thank you very much. I appreciate it. All right, we are going to get started here. My name is Dawn Clifford, and I'm the Director of Education. I have been with Globiotics for over a year and been in the industry for over 32 years. I have a long, extensive background in medical aesthetics, but have been educating for probably the past almost 20 years of that 32-year career. So I'm here to answer any questions that you might have regarding protocols, ingredients, diving a little deeper into the products for you. I can help you with all of that. So you can always reach me at my email, which is education@globiotics.com. And I'm very good at answering my emails, especially now since we are all kind of sequestered at home and working from home. You'll have a response from me either the same day or within 24 hours. So I look forward to hearing from you and answering any questions that you might have. So today we're going to really dive into hyperpigmentation. We're going to start with the cause of it, then we'll talk about a couple different types of hyperpigmentation, probably the ones that we see the most as estheticians and medical professionals. And then from there, we'll talk about what we can do, especially with the Globiotics products, in combating this difficult condition. So when we talk about hyperpigmentation and the causes, there are so many different causes of hyperpigmentation. It's very important to investigate before treating what the root cause is of this hyperpigmentation that your client or patient might be suffering with. As you can see on this screen, there's many listed, but I'll just touch on base on a few of them. Sun damage. I think the majority of the visible hyperpigmentation is a result of UVA or UVB radiation over long periods of time. We'll get into that a little bit deeper. Medications or cosmetic ingredients. I think a lot of us don't consider that sometimes some of the ingredients or even modalities that we may be using could actually antagonize the melanocyte and cause hyperpigmentation. That's the last thing, of course, we want to do, but it is something to take into consideration, especially with your higher or darker Fitzpatrick's. Medications is another thing that we need to look at, because oftentimes we look at health conditions as being a trigger for different skin conditions like excessive inflammation, rosacea, hyperpigmentation, acne, etc. But sometimes it could be a medication that somebody is taking that actually triggers that pigment. Aggressive treatments, as we were saying, certain modalities. Inflammation, we're going to talk a lot about inflammation in the melanocyte today. Hormonal changes, another thing that we're really going to touch on today. Genes, a lot of times just the genes that we're born with, our hereditary factors can give us or lead us into hyperpigmentation conditions. And age, of course, age is another factor to take into consideration. As we get older, the more sun we've had, etc., the melanocyte tends to pigment that has been there underlying in the dermis for years can show suddenly on the epidermis. So now we're going to take a look at the histology of pigmentation. And this really, of course, all starts with the melanocyte. So to understand how to lighten pigment, we must first learn how pigmentation is formed. So we're going to take a little bit of a closer look at color of melanin and how it's formed within the melanocyte. So the melanocyte resides in the basal layer, of course, of our skin, and very deep within the skin. Excuse me. And the melanocyte produces a byproduct, which is called melanin. This is the pigment that is produced by the melanocyte. So when we talk about the melanocyte, the skin tone that we're born with is really developed by that melanocyte, because our body, the melanocyte, actually works as a protective mechanism. The more sun exposure we have, the more melanin that's produced. And because of that, the darker our skin can become. So when we're talking about this protective mechanism, the melanocyte, although it sometimes deposits pigment that we do not want, it doesn't know that it's not doing us a favor, because it really thinks it's doing us a favor by creating almost a mask for us of protection from the sun, from the heat, from aggression. When we talk about melanin, melanin is the pigment, of course, that's formed within the melanocyte cell. It's this substance that's responsible for the color, not just in our skin, but also in our hair, in our eyes, and other parts of the body. And the production of melanin is the end product that is formed during the metabolism of the amino acid tyrosine. And we're going to be talking a little bit more about that when we get into melanogenesis. Two types of melanin can be formed on the body. We either will experience eumelanin, which is the dark brown type of pigment and melanin that occurs in the skin, or we can also experience pheomelanin. Pheomelanin is kind of more of a red tone in pigment, and we'll show that again when we get to melanogenesis. So the next factor when we talk about the histology of pigment is the melanosome, and then the transfer of the melanosome to the keratinocyte, or the melanin, I should say, to the keratinocyte. The melanosome is basically kind of the package, if you will. I love the way that we describe this. It's kind of the package of melanin that's delivered from the melanocyte via the dendrites. So it's kind of this cycle that happens within our skin, and this melanin, when it's formed, has to be passed from, think of it like a relay race, passing the baton from one to the other. So we are, the melanosome kind of grabs hold of that melanin, transfers it to the dendrite, and then the dendrite, of course, the melanocyte, the melanin, excuse me, is released into the keratinocyte. The keratinocyte absorbs the melanin, and then because our keratinocytes travel and are always raising to the surface of our skin, this is when we can get deposits of that pigmentation on the surface of the skin. But remember, some of that also will stay dormant within the deeper layers of skin as well. Now, cell DNA protection is an important factor as well, because when the melanin forms, a protective cap over the cell nucleus is formed, and when that occurs, when we talk about that occurring, excuse me, I'm sorry, I have a little cough going. Basically, it's almost like a shield. And it makes it much harder for the pigment and for us as professionals to actually be extracted or lightened, if you will, from the skin. So in general, it's important to understand too that everyone has the same amount of melanocytes. It doesn't matter if you're a white, Caucasian, light-skinned person, or if you're of Latin descent and you're kind of that medium golden brown color, or if you're of African American descent and you have very, very deep dark brown skin. We all have the same amount of melanocytes, but the darker your skin tone or your higher your Fitzpatrick, the deeper, the larger the melanocyte is, and the more melanin it produces, especially when triggered by inflammation, triggered by UV, triggered by medication or illness, or all of the things that we're going to talk about today. So that's an important factor to remember, especially when you're going to treat someone with darker skin. Remember, if you're doing a chemical peel or performing a modality that causes any kind of thermal heating of the skin, that melanocyte doesn't know whether that's UV radiation, doesn't know where that heat factor or inflammation is coming from, and that melanocyte is going to activate. And when that melanocyte activates, it's going to produce melanin. That's why when we chemical peel or use, for example, lasers or IPL on our patients or clients' skin, we have to be more conservative with darker skin types because we don't want to activate the melanocyte. So that leads us to melanogenesis. The melanogenesis is really a cycle that occurs deep within the skin, and it's really the release of a chain of amino acids and enzymes through glycation that occurs for this melanin to form. So it all starts with the trigger. The trigger might be, as I've been talking about, inflammation. Let's say you get a mosquito bite. Let's say you have acne. Let's say you've had a laser service done. A chemical peel, doesn't matter what it is. As long as there's inflammation that is being occurring in the skin, we will trigger an amino acid production called tyrosine. Tyrosine then will be triggered, will trigger the release of tyrosinase. Tyrosinase is what we always talk about when we're talking about how to inhibit pigment, because there are many ingredients, which we'll be talking about today as well, that can actually inhibit this enzyme, which is actually a copper-rich enzyme called tyrosinase. Then through the process of glycation, we actually will trigger another amino acid called dopa. This in turn triggers once again tyrosinase. Then glycation starts again, and dopaquinone, the stronger enzyme, is formed, or triggered, I should say. So as you look at this chart on your screen, on your computer screen, what is the one common thread here? I have them circled or squared off in red for you. It's tyrosinase. Tyrosinase is triggered through this cycle of melanogenesis twice. What's the best way to break a chain? It would be to get rid of the common denominator, or the common thread, in this case, tyrosinase. So when we talk about tyrosinase inhibitors in skincare products, that's what we're talking about. We're going to break the chain of melanogenesis or inhibit it so that we are not producing more melanin. Remember, once again, two forms of melanin can be triggered, and it really has a lot to do with your Fitzpatrick and your skin type. Pheomelanin is again, more of a reddish type pigment. Think about those of maybe Fitzpatrick's 1s and 2s, Irish descent, English descent, Swedish, except the northern regions of the United States, even lighter skin, right? Think of their freckles on their skin, or when they do get pigment, it's more red. So that's what I want you to imagine here. Eumelanin, on the other hand, is the type of pigment that's going to form more brown, darker pigment. So think of your Fitzpatrick's 3s, 4s, and 5s. Your olive tone skin to brown skin to very dark skin. That's going to be the brown pigment that forms within the skin. So what we're going to talk about today and where we're going to kind of dive into is, I picked 3 of all of those causes, and I picked the 3 that I feel that we see the most within our practices. Hormones, triggered pigment, excessive inflammation, and there's many different causes of that. We'll get into some of those. And then UV exposure. And just remember, this little graphic that you see on the left-hand side of your screen, this is kind of just showing the cutaneous inflammation that may occur, and it could be from a million different things, UV modality, again, a bug bite, a burn, and then just how that itself then triggers the tyrosine, triggers that copper enzyme tyrosinase, and how that triggers the melanocyte activity happening within our skin. So I thought today we'd start with hormonal triggers, because I really feel that hormonal triggers are something that we see more and more of, especially now with our Generation X and baby boomers really being the largest part of our population. A lot of our clients are in that age range. So hormonal factors such as menopause can definitely be an issue, as well as for our younger clients who are suffering with acne, let's say. Again, when we talk about maybe puberty and that. So this is going to be kind of a deeper dive for you. We're going to talk about the hormonal triggers and how this actually occurs. And on your screen, you're going to see a really cool graphic of the brain and where the pituitary gland resides. And many of you may not realize that the pituitary gland is actually what produces melanin stimulating hormones within our skin, within our body, basically. So when we talk about the pituitary gland in the brain, it actually picks up a signal that generates melanin stimulating hormones. So these hormones stimulate inflammatory and immune response within our cells. Estrogen and progesterone bind to the intracellular receptors, and when UV exposure in any form, so whether we're outside playing tennis, whether it's prolonged UV, or whether we're just driving down the road and we have UV exposure, that will again trigger melanogenesis. And especially during pregnancy, increased estrogen can trigger pregnancy mask or melasma, or during menopause at the other end of the spectrum, when there's a depletion of estrogen, melasma, or some people as that develop pigment later in life call it chloasma, can be triggered as well. On the graphic that you see to the right-hand side of your screen, this is just another kind of graphic showing the anterior pituitary gland. And what I've kind of boxed in there is how it affects the ovaries. And of course, that's where we get the trigger of estrogen and progesterone. But you can see through the graphic that there are many, many other functions that the pituitary gland has as well. So some hormonal triggers that occur when we're talking about that melanin stimulating hormone being stimulated. The first one is melasma. So when we talk about melasma, this is the female hormone estrogen. Really is an intricate part of affecting melanocyte activity. Oftentimes, melasma is coined the mask of pregnancy because really about 90% of the time you will see melasma or that butterfly type mask show up on skin during pregnancy, but it can also occur at the other side of the spectrum during menopause as well. So once again, when we talk about the pregnancy mask, oftentimes this can appear with some ovarian issues, sometimes PCOS, polycystic ovarian syndrome. Also, some thyroid disorders have also been known to bring this type of pigment on because, again, it's a fluctuation of the hormones. Similar changes are seen in women also when they are on birth control pills. And the condition can persist for up to 5 years after pregnancy or stopping birth control. So sometimes women who have gone through pregnancy and nursing never have developed any type of pigment on their skin, especially something as severe as melasma or this pregnancy mask. And then suddenly, if you have a fluctuation in your hormones, suddenly you get pregnant a second time. Maybe you go off the pill and you trying to get pregnant. There could be many different triggers. You can suddenly develop this pregnancy mask. And it's really common in 75% of women that are more around the childbearing age. Men can get something that's, very similar as well, but not quite as severe. So when we talk about the pregnancy hormone, and we see this line on this woman's pregnant belly, many of us experienced this. This is due to a large concentration of melanocytes and androgen receptors. And it can also be found the exact same type under the arm and sometimes on genitalia. So when you have a client or patient who comes into you with dark pigment under the arms or sometimes around the groin area, you will oftentimes, it's actually the same hormones that are causing this kind of line up the woman's belly during pregnancy. This happens to really about three-fourths of all pregnant women, and usually during the second trimester. It's more common in darker skin, and sometimes some women will get it as a faint white line instead of a darker line. And again, the cause again is during hormones during pregnancy, and it is treatable post-pregnancy, but very important to have that area stay away from the sun, because it will come back even not during pregnancy. It can be triggered by UV radiation. And last but not least, I thought I would talk about stress. Many of us are going through this right now. It's not an easy situation that we're all currently living through. So a lot of us have very high stress. And during stressful times, our cortisol levels are raised. And this happens to trigger testosterone as well as the adrenaline hormones. So when we talk about the adrenal corticoid hormone levels, they are raised during very stressful times. And if stress is an ongoing factor within your life, you can notice a change in color of the skin, triggering melanocyte activity. This usually will occur around the jawline or the outer perimeter of the face. So it's also kind of a hot button when some people get stressed. They get very hypersensitive and they'll get kind of flushed around that jawline, that neckline. And this is where you can see brown pigment, or in fairer skin, that pheomelanin, that redder pigment occur. So I thought now we would move on to inflammatory conditions or triggers that may occur in the skin and trigger pigmentation. So when we talk about inflammatory triggers, there's a chemical messenger that actually triggers the melanogenesis cycle. Inflammation occurs as a response to whether it be UV radiation, forms of skin irritations, trauma to the skin. It could be acne, it could be a bug bite, it could be a scratch, it could be a burn. Those are considered trauma to the skin. It's something that we're doing in our practice. Maybe we have our laser settings on too strong for a darker skin type. Our IPL can sometimes cause trauma or inflammation. Same thing. The skin, remember, doesn't know where that trauma or inflammation is coming from. So again, it could very easily think that it is trauma, and it would, of course, then trigger that melanocyte. Especially when we talk about impaired barrier functions, this can have visible or even chronic inflammatory conditions, lead to chronic or inflammatory conditions such as like dermatitis, psoriasis, eczema. That too can lead to inflammation and triggering of the melanocyte. So when there is inflammation, the Langerhans cells, keratinocytes, and the melanocyte cells are stimulated. So we're going to explore a little bit here about some different ways that that inflammation can occur. And we're going to kind of look into it a little bit deeper. So let's start by talking about post-inflammatory hyperpigmentation. I think this is something that we deal with quite a bit in our industry, whether we be estheticians or medical professionals. Basically, it's changes in the pigment that result due to trauma in the skin. And again, the response to insult increases production and causes abnormal distribution of the melanin in the tissue, generally when the skin's immune response is activated. Melanocyte activity is also a small reminder of exactly where the trauma is occurring, because that's where we're going to see this kind of PIH, or post-inflammatory hyperpigmentation. Recent studies have shown, and this is kind of interesting, that depending on the depth of the inflammation or the wound, if you will, hyperpigmentation can not only be evident on the epidermis, but also can be as deep as the dermis as well. And this may account for difficulty in treating PIH, and especially if it has scarring along with it, and that pigment has deposited deep within the scar tissue as well. It is very treatable. It is usually a lower level of inflammation, and we can desquamate it usually pretty simply if it's especially epidermal off the surface of the skin, as long as we're not triggering more inflammation. So I always say when I'm treating PIH, or that post-inflammatory hyperpigmentation, I always like to go with my low and slow philosophy, treating it a little less aggressively, maybe doing a few extra treatments would be better than going in there aggressively trying to lighten that pigment. Then we have wound. When we talk about wound triggers, this could be a lot of things. Again, in the picture that you're seeing on the left-hand side of your screen in the middle, this was IPL set to too high of a setting. The wound initiated a moment of injury. Scar tissue can be formed, and it has a denser collagen than normal. And severity of a burn will increase side effects such as swelling, infection, and inflammation. All three of those things, swelling, infection, and inflammation, can trigger more melanocyte response. So once again, for me, when we have a wound on the skin, the most important thing would be to allow that wound to heal. So allow enough healing time and then go in and try to correct the condition. Again, more of a low and slow philosophy. A lot of what you see on that patient in the center is going to eventually peel off or lighten up on its own. It's initially very scary for not only the patient or client to see this on their skin, but for you as well as a practitioner. Remember, if you're less shocked, the client or patient will be less shocked. So tell them, yes, this is a temporary situation. It will fade. Let's give it time. You give them all the tools they need, sunscreen, tyrosinase inhibitors. We're going to talk about all that. And then you will ease them through the recovery process. And finally, when we talk about inflammatory triggers, I want to talk to you about inflammatory skin conditions like dermatitis, eczema, psoriasis, other things that can cause type of rashy skin irritations like what you see at the bottom of your screen. This is usually a raised rash like what you're seeing on your screen is a precursor of post-inflammatory hyperpigmentation, because especially if the patient or client is scratching it and itching it and not putting on something to soothe it, they will of course trigger more melanocyte activity and they could be left with that PIH. Thickening of the skin will occur, and this can sometimes deposit even pigment deeper into the skin. And usually most of these are viral conditions. Usually it has to run its course. Of course, there are many topical medications that can be offered for this as well from a physician. A lot of us that are estheticians will recommend that the client use things like hydrocortisone and that. The problem with continued use of hydrocortisone is basically an antihistamine. So yes, it's going to stop the itching. Yes, it might bring down the redness a little bit, but it doesn't allow healing because it actually is blocking the immune system. So if that is happening, and if our immune system is kind of dormant because of the hydrocortisone, we're not going to get full change in the skin condition. So that leads us to UV triggers. The majority of the hyperpigmentation that we see as professional is probably the result of UV exposure. If the sun exposure is the only stimuli, treating the effects of the sun are much easier compared to UV with additional stimuli such as hormones or medications that stimulate the melanocyte as well. Certain medications or cosmetic products like things with a lot of fragrance can cause skin irritation and inflammation, triggering that melanocyte, and that increases sensitivity to the UV exposure as well. So not only are they getting regular UV exposure, but they're photosensitive. And this makes the skin even more susceptible to sun damage. So when we take a look at UV triggers on this graph, we see the sun, of course, emitting ultraviolet radiation into the skin. When the skin cells are exposed to UV light, inflammation is triggered. Whether we burn or not, it doesn't matter if we see redness on the surface of the skin, it is happening on a thermal degree. That radiation is penetrating our skin. Once that inflammation is triggered, that melanocyte starts its cycle of melanogenesis. And just as we talked about earlier in the more detailed graphic, the melanocyte produces melanin. The melanin is captured by the keratinocytes. The keratinocytes bring this pigment to the surface of the skin, as well as leaving some in the dermal layer of the skin. Now, when we talk about UV triggers, we will once again talk about, for example, sorry about that, such as, we'll start with actinic keratosis. That's the top photograph that you're seeing. This is a rough, scaly patch that occurs on the surface of the skin. It doesn't occur in all skin types. You will notice this mostly in your skin types, Fitzpatrick's 1 through 3, maybe even 4s, especially across the chest, the neck, yes, on the face. A lot of times, often on men, you'll see it if they have hair loss, and you'll see it across the forehead and on their bald head. But it can happen on the arms. It can happen anywhere, actually. It is a benign spot. It can be treated with laser or chemical peels, as long as it's not an open wound that they've been itching and scratching and they've caused some infection in there. It's really, this dry, scaly spot is caused by years of sun exposure, but it is very treatable, and we are fortunate enough to be able to, as professionals, treat it. But I always say, whenever you're dealing with any type of skin discoloration, mole, rash, anything that you are not sure of, never treat it. Always refer to a dermatologist. It is very important, because we would not want to be using chemical peels or laser or IPL on a malignant type problem on the skin. Then pigment triggered by UV radiation. The picture in the middle of the left-hand side of your screen is more of that photo damage, not that solid melasma mask that we see with hormone production or fluctuation of hormones. This is more spotty. It could take years to show itself on the epidermis. The standard, we used to say years ago when I first worked for my first dermatologist, we would say that it would take 10 years to surface what you did laying out in the sun 10 years ago. It would take 10 years for that to come to the surface of the skin. And that happens with the synthesis of melanin and melanocyte activity within the body, of course, the thinning of the skin, and continued UV exposure. This can go very deep, and one of your best tools that you could use would be something like a Vizia or an ultraviolet camera, or even a Woods lamp for those of you still using Woods lamp out there. They're very useful tools because that ultraviolet light will show us just how deep that pigment goes into the skin and what kind of a fight, if you will, that we're going to have on our hands in trying to combat this pigment in the skin. And then there's another condition I wanted to bring to your attention, and it's very common, especially again as we're talking about our Generation X and baby boomers being the largest part of our clientele and age-wise. Poikiloderma. Poikiloderma is a chronic non-cancerous skin condition. It's again caused by long-term sun exposure or continued inflammation reaction through that neck and chest area. It's a skin discoloration that usually is underneath the jaw, down the sides of the neck, through the chest area. Years ago, we used to call this perfume staining because oftentimes perfume, because of the high alcohol content, and women who used to put it on the exact same place on their neck, we used to put a little dab on the neck behind the ears, we would have this type of pigmentation spotting on our necks and chests. And now we have found, of course, that it's not just the alcohol content from skincare products or fragrance, but it is a, again, chronic UV exposure condition. So after all of these different triggers that we've talked about, what can we do to prevent the hyperpigmentation within the skin? So there's a lot of different things that we can do, and I'm going to really dive into ingredients here with you as far as trying to combat the melanogenesis process. So when we want to inhibit the signal that triggers melanogenesis, SPF is always going to be our best shield. Every single one of our patients and clients should be using nothing less than an SPF 30 on a daily basis. It doesn't matter if you have SPF in your foundation, you should still be using an SPF on top of it. But SPF 30 to 50 is your best bet. And also it doesn't matter if you just go from the house to the car and go into an office, house to the car, go to the grocery store, go to school. You are still getting UV exposure and you're still susceptible to UV damage. So SPF is our best fight in the hyperpigmentation battle. Antioxidants. Of course, we all know antioxidants protect us from free radicals. That free radical damage is another trigger that can happen and trigger the melanocytes into producing more melanin. Oligopeptides. There are so many different peptides, tripeptides, tetrapeptides, biopeptides. There are a million different types of peptides, but oligopeptides specifically are excellent at actually inhibiting the melanogenesis process. Also, another active ingredient that you will find in a lot of lightening agents is red and brown algae. Now, red and brown algae may not show up on your ingredient list as red or brown algae. It could show up under a trade name. There are thousands of them. It could show up under its INCI name, which is much longer and in more detailed name. So for you to investigate your ingredients of the products that you're currently using is important. Now, when we talk about inhibiting the melanosome transfer, so remember that melanosome takes that melanin and it's going to transfer it to the dendrite, which is going to transfer it to the keratinocyte. How can we inhibit that from happening? Once again, oligopeptides, very key. Red and brown algae. Niacinamide, which is B3, very important and very active ingredient, has many different benefits for the skin, but it's a very important ingredient when we talk about that inhibiting that melanosome transfer. And hydroquinone. We know that there are a lot of controversy regarding hydroquinone, but it is and still continues to be one of the best inhibitors, as well as one of the best lightening agents when used in a lower percentage, and safe when used in a lower percentage. Now, when we talk about inhibiting tyrosinase activity, there are many different ingredients. So these are tyrosinase inhibitors, and on the next slide, you're going to see even a larger list. But tyrosinase inhibitors can be anything from zinc glycinate, oligopeptides, again, that red and brown algae, magnesium ascorbyl phosphate, which we call it MAP, which is another form of vitamin C, arbutin, kojic acid, azelaic acid, licorice, hydroquinone again. These are all very common tyrosinase inhibitors that you will find in skin lightening and brightening products. So here's a list of some of my favorites that I like to work with, depending on the degree of pigment that we're trying to inhibit and where they're derived from. So when you're looking at a label of a skincare product or packaging, and you're looking at the ingredient list, the INCI list, and you see hydroquinone, it's important to know that that's derived from benzene. Kojic acid is usually from mushrooms. Licorice is, of course, licorice root. Azelaic acid, there's many different places it can be derived from. Generally, it's a barley, rye, or wheat. Arbutin are berry fruits and pears. Rumex, sometimes you'll see it as Rumex crispus on a INCI list. This is from actually a plant called Rumex genus. Bearberry is from the bearberry plant. BVOSC, which is a stable form of vitamin C. Stem cells. We'll talk about some of these specialty cocktails. For example, one's called white, excuse me. Peptides, dipeptides is another one, along with oligo that is very active in melanocyte inhibition, and Beldes, which is a daisy flower. So one other point that I didn't mention yet is the exfoliation process. And this, of course, is going to work more for that topical epidermal pigment for lightening and getting to brightening the skin tone, if you will. And that's where really our enzymes, our alpha hydroxy acids, as well as beta hydroxy acids come into play. So what I did was I just put a few down here, but probably the one of the most important would be retinol, because retinol will give advanced exfoliation. We just want to make sure that it's not too strong and causing underlying inflammation, which we've talked about enough today for you to know that that's a no-no. Glycolic acid, lactic acid, salicylic acid, enzymes, they all have different degrees of exfoliation. Know your percentage before you apply it to the skin or recommend it to your client or patient. So within the Globiotics line and within other skincare lines, we do have several actually advanced lightening, I like to call them cocktails, and they're options within our skincare products that actually will give you a boost to lightening and some of these other ingredients. Now, important to know that when we talk about Globiotics, we do not actually use any hydroquinone in our products. So we do use things like azelaic and licorice and kojic, but in addition, we have some of these, what I like to call smart cocktails, and these are advanced lightening. For one, for example, is called ActiWhite. And ActiWhite is one of those ingredients that excuse me, is actually a combination of two different things, a pea and it's a stevium pea extract and sucrose dilaurate. And these two ingredients together actually give you a very active ingredient. So the names you're seeing on the left-hand side of your screen are actually trade names. So these are the names that our laboratories give to these cocktails, if you will. But the true derivative is generally, especially when you're talking about peptide, synthetic. If we can go to a natural source, we will, but you have to remember that peptides are synthetic. There is nothing that you can derive a peptide from and then put it into skincare. Yes, we have natural peptides that are in our bodies, but they cannot be replicated by a plant source, for example. So, for example, we'll take Smart Peptide 189. This is a nanopeptide, and this, again, synthetically derived to mimic our own peptides within our skin. This actually helps revert retinol, any kind of retinols that we're using into retinoic acid, and thus it's going to actually give us an even better reaction to a retinoid. Something like when we talk about Symwhite. Symwhite is a form of resorcinol. Resorcinol, again, is a synthetic ingredient that is derived in a lab, but again, helps with the lightening process. So look for these ingredients. You will not see the trade name on your labels, but you will see where they are derived from, the derivative on the inky label. So how can Glowbiotics help? As a pioneer in probiotic skincare, Glowbiotics maintains the integrity of the skin while delivering results. Glowbiotics' focus has always been the reduction of inflammation and rebalancing of the skin's ability to heal itself. And that will give us beautiful skin from the inside out. So our philosophy has always been from day one about less inflammation in the skin. Less inflammation will, of course, help to inhibit that melanocyte activity. When we talk about probiotics in the skin, a lot of people don't relate probiotics to melanocyte or hyperpigmentation, but remember, probiotics actually help in the recycling of the metabolism of hormones within our body when we take them into our gut for gut health, right? It's the same way when we apply them to the surface of the skin. We are not going to alter the hormones from applying a skincare product to the surface of the skin, but what we can do is help to balance the inflammation, balance the skin, and reduce the symptom that that hormone fluctuation may have shown on the surface of the skin. So some hormonally induced conditions that we've talked about in other webinars, PCOS, that polycystic ovarian syndrome, thyroid, estrogen depletion, pre and post pregnancy, of course, and certain autoimmune disorders. So I thought we would talk just real quickly before I get into the products of which products from Glowbiotics are great for lightening and brightening the skin. What exactly pre, pro, and postbiotics are, because this will actually help you understand why they help to diminish inflammation and thus diminish melanocyte activity. So prebiotics are actually like the fertilizer. Think of them as the food that encourages microorganisms to grow. They are natural partners of probiotics, and they increase the production of this important bacteria. Now, we all have bacteria that lives on the surface of the skin, part of the mitochondria. And especially now with the viruses that are out there and what we're, the reason we're all stuck here at home, we want to have a balanced microbiome. So we need the good bacteria as well as the bad bacteria, but we need a balance of this. Remember, bacteria is different than virus. So it's important that we balance that microbiome. Now, when we talk about probiotics, they're the microorganisms themselves. They naturally live on the surface of the skin. They create a protective veil. And again, we refer to that as the microbiome. When our skin's microbiome is out of balance, it helps offset, when your skin's microbiome is in balance, I should say, it helps offset factors that can negatively influence the skin, such as redness, dryness, irritation, weakening that surface of the skin, and then we are not going to be protected from environmental attacks or even something that's going on systemically like melanocyte activity. Postbiotics. Postbiotics are becoming more and more a recent topic of conversation. They're actually a chemical byproduct of bacteria, such as antimicrobial peptides and fragments of dead bacteria cells that remain on the skin. More and more probiotics are being used, more and more probiotics are being used more commonly in skincare as they do not expire. And the way that it's actually extracted or becomes a postbiotic is they extract an enzyme or a lysate from a live probiotic. It is fermented, and then through that fermentation process, we don't have to worry about expiration in skincare products. Instead of a few days, we still have months like we normally do in any other skincare product. So when it comes down to the bacteria, it's all about balance. The good bacteria, which we like to call the beauty bug, has been shown to act as a natural protective shield against the bacteria, fungi, and even viruses. When the microbiome is out of balance, the immune system cannot release various antimicrobial peptides that help balance the skin. By balancing the microbiome, good bacteria can inhibit the release of inflammation, compounds from the immune system, and inflammation that triggers the proliferation of the bad bugs, the bad bacteria. This is just a list of some of the different skin conditions that we don't even think about that is caused by inflammation or skin that is out of balance. Psoriasis, allergies, eczema, dermatitis, acne, poor wound healing, all of the things you see listed here. The power of the beauty bug. So what does the probiotic, the good bacteria do? It strengthens the skin, so it protects us from environmental threats such as UV. The inflammation from UV, we should be saying, enhances the skin's ability to become and stay more properly hydrated, diminishes factors that trigger sensitized skin and redness, visibly improves dryness, including that tight, uncomfortable feel, and it restores the pH balance to the surface of the skin. One other thing I want to mention before I get into a couple product recommendations is that we have we are 100% committed to clean beauty. This is a list of our no-nos, ingredients that we do not derive our products with, parabens, phthalates, sulfates. You can see this long list here, and the list continues to grow. We have no problem with when an ingredient might become kind of a red alert. We will have no problem in going to the drawing board and seeing what we can find to once again diminish the use of using that ingredient, and we never want anything toxic or harmful in any of our products. So a few products that I'm going to recommend, and then we'll get to your discount, and you'll all be able to get a little discount if you place any orders. So our probiotic instant resurfacing pads. These pads, oftentimes people think of a pad as an acne pad, but this is almost, it's almost, and our owner Christine Watson says, when is a toner not a toner? When it's a lightening resurfacing product, and that's what this is. These pads are wonderful for brightening the skin tone. Yes, they can be used on breakout, but also great for pigment because they do have lactic acid in them. They basically come on a pad. The liquid's already on there. It's great to take to the gym. It's great for staying at home and just doing a quick swipe over your face after you've exercised or whatever the case may be. I travel with these. They're really nice. Some of the ingredients that you see, we have this wonderful balancing complex again that has prebiotics, probiotics, and vitamin C in it, as well as that ammonium lactate, which is a lactic acid. Again, when we're talking about lightening pigment, lactic acid is key here. And then we also have our probiotic brightening and refining layering solution. This is basically the liquid form of what is on those pads. Exact same ingredient deck, nothing different other than this comes in a bottle and it's a pump, and you have the choice of having this on your medicine bathroom counter, I should say, or in your medicine chest, and using a cotton pad with it instead of the pads in the jar. So again, protects the skin barrier from transepidermal water loss, brightens and lightens your skin tone, and retexturizes the surface. Same exact ingredients, so I'm not going to take time to go through those. Then we have our retinols, and we do have a family of 3 retinols choices from Globiotics. I have them in order from left to right in strength. So I really believe when using retinol or recommending it for one of my patients or clients, using a step-up method, starting with your lower percentage of active retinol, going to your middle percentage, and then going to something that's even stronger for more advanced conditions. So when we talk about retinol in our kind of starter form, maybe for a teenager, maybe for someone who has skin irritation, maybe for someone who has never used retinol before, that would be our retinol, anti-aging, and brightening treatment. This has a pure retinol in it. It brightens, it helps with exfoliation. It also helps to lighten pigment in the skin. Once again, we have that balancing complex of probiotic as well as vitamin C. We also have a retinoid complex in this. And for pigment, we have a pigment complex, a combination of niacinamide, synovia, which is an alternative to retinol, and that ActiWhite that we talked about earlier as a lightening alternative. Then we go up a step to our advanced retinol renewal treatment. This is very active, and this would be for someone with very resilient skin or for someone who has used retinol in the past. Again, same benefits, but to a stronger degree. Helps with hyperpigmentation, great for acne as well, and that post-inflammatory pigment, great for lines and wrinkles and aging skin. It has a retinoid complex in it. It has smart peptides in it that we talked about. ActiWhite, ChromaBright, again, lightening agents, brightening agents for that pigmentation, as well as inhibitors. They help to inhibit that melanocyte activity. And then we have some conditioning agents in it as well, vitamin E, safflower oil, green tea, shea butter. And then we have the ultimate. This is our ultimate youth restoring serum. And this is the ultimate. It's really a 3-in-1 because it contains vitamin C, retinol, as well as peptides. So this is kind of that patient that says to you, I want one product that does it all. This is the granddaddy. This is it. It helps to reduce visible signs of dark spots, signs of sun damage. This is the one that I love to give to those sun worshipers. It tightens, it firms, it helps with fine lines and wrinkles. And once again, it has the probiotics in it, several different peptides, our retinol complex. The vitamin C in this one happens to be a magnesium ascorbyl sulfate. We have anti-inflammatories, again, some of those advanced lightening and brightening, as well as melanocyte inhibiting ingredients in this one. And then a couple other serums that I like to recommend for treating as well. Our first one is our advanced vitamin C, and the second one is our calming restorative serum. Now, calming serum is not going to help with pigment. The only reason I added it to this presentation is because it is wonderful for helping to reduce inflammation. And as we talked today, we know that inflammation is one of the biggest triggers of melanocyte activity. So we'll start with our vitamin C. It's one of the best ones I've ever used. It causes no irritation. It has no fragrance in it. It has no coloring to it. It actually will not cause any type of irritation. If you've had a client try vitamin C before and not been able to use it because it irritates their skin, have them try this one. Patients love this product. It has a dual C complex of magnesium ascorbyl phosphate along with ascorbyl glucoside, so it's a 10% combination of vitamin C. We have that smart peptide in it again that I've talked to you about earlier. Glutathione, which is a wonderful lightening and brightening agent as well. A little bit of sodium hyaluronate, hyaluronic acid for the skin. Bearberry, another wonderful lightening active ingredient. And then our calming restorative treatment. This again is going to help cut back on the inflammation. I would suggest if they are using, let's say, a retinol at night, they could use the calming restorative treatment during the day to combat inflammation. And it's really a great balancing act between these two products. Same, you could mix a little bit of this with the vitamin C during the day because vitamin C, of course, can be used during the day. You'll see many ingredients in this, actually 2 slides worth. Octapeptide, remember we talked about how it's wonderful for pigment. It's a smart peptide with 2 different octapeptides in it. Hyaluronic acid, tightening agents, as well as anti-inflammatories. We also have 2 lotions. The calming lotion, which is just the match to or the pair for that calming treatment, which again isn't going to help with pigment, but it's going to help subside the inflammation. And then our probiotic brightening renewal lotion. The brightening renewal lotion is the one I'm going to spend time with. This one helps to lift and also help to diminish dark pigment in the skin. So great for those sun worshipers for brightening the skin. It will not make you sun sensitive. It can be used day, it can be used evening. Of course, an SPF should be used over it because it does not have built-in SPF protection. You can see the list of ingredients here: probiotics, ActiWhite, beta-glucan, borage oil, chamomile, again, sepia white, those peptides that we've been talking about brightening the skin, even laurel lactate, again, alpha hydroxy acid of lactic acid, all brightening, all pigment reducing, all inhibiting agents as well. And then that calming lotion, again, anti-inflammatory, anti-irritating to the skin. The perfect, if their skin gets a little bit irritated, we want to calm, we want to make sure that melanocyte does not get activated. The calming lotion is what you would reach for. And then we also have 2 creams. Now the difference between the cream and the lotion is lighter weight, more daytime use. Creams more for nighttime use or for your excessively dry patient. So we have our multi-brightening anti-aging cream and then our ultra-rich brightening cream. So the multi-rich brightening and anti-aging cream is of course a nice, thick, rich cream, reduces wrinkles, brightens and lifts unwanted pigment, or I should say fades and lifts unwanted pigment. The benefit of this cream is not only does it have the brightening agents in it, but it also has anti-aging benefits in it as well. So you see that ActiWhite and that ChromaBright and those probiotics, those peptides we talked about, the sepia white, and also vitamin E and safflower oil for a little bit of anti-aging benefit. And then our probiotic ultra rich brightening cream. This is strictly going to focus on brightening and clearing and giving clarity to the complexion and giving a luminous glow to the skin. It fades the pigment, really nice, especially for photo damage. This has, again, that balancing complex in it we talked about earlier, has that niacinamide that we talked about, that B3 that is so good for helping to reduce inflammation and that triggering of the melanocyte. We have an anti-aging complex in this, as well as a barrier repair complex in this. So we are going to give a nice lipid-rich barrier for the skin. And last but not least, we're going to recommend for you an SPF. Globiotics has one SPF. It's a tinted SPF 30, very unique SPF in that it is an anhydrous formula. Anhydrous, what is that, you might ask? It means it has no oil in it and no water in it. It actually feels almost like a makeup primer when you put it on. And yes, it's tinted, but the tint will not leave even dark skin with a kind of ashy mask. It blends into the lightest of light skin to the darkest of dark skin. I will tell you, on my days off, I take a little bit of this with a little bit of my Hydroglow cream oil. I mix the two together, and that's what I wear all day long. And I will tell you, a lot of you are also thinking SPF 30, that's not enough to wear for if I'm going out in the sun to play tennis or golf or going to the beach. Not that we can do any of those things currently, but this product, you put it on, it will not move from your skin all day long. I live in Florida. I can go to the beach and put this on before I get to the beach. When I get home, I have to wash it off my skin, even if I go into the ocean. Now, standard recommendation of reapplying sunscreen, of course, is important to tell to our patients and clients. But I can tell you, I have never gotten sunburn or overly exposed to the sun wearing this product. Some of the ingredients you see, it's completely chemical free. It's a pure physical sunscreen, 11% titanium, 4% zinc, lycopene, which is a great antioxidant found in tomatoes, has a melano sponge in it, which is actually helps to soak up the oil so that we have kind of a matte finish. It also has a little tint. That's what gives you that beautiful tint. And then we have a couple in-office treatments, and I'm not going to spend a lot of time on this, but I did want to mention them to you because I think, especially for severe hyperpigmentation, it is difficult for us to have the patient only treat their skin with skincare products. Sometimes it takes us to give them a boost of a chemical peel at home. And not at home, in the office, excuse me. So these are professional only peels. They are self-neutralizing. We have two options. The white labeled bottles you see are actually our prepping solution or our degreaser. And then the two peels are our Youth Boost peel and our Nourishing peel. I'm going to skip this slide just because I know we're running over on time here, and I know some of you need to get to the end slides with our wonderful discount offer on it and the promo code. But basically, this slide is just telling you basically what we've done is we've taken our peels to a higher plane. We have actually added the probiotics for the balancing and anti-inflammatory, and you will, when you use these peels and try them, see the difference compared to regular chemical peels. It can treat, both of them can treat all different skin conditions, everything from acne to pigment to rosacea, and even just hormonally challenged skin. The Probiotic Youth Boost, which is the stronger of our two peels, is a self-neutralizing 29% lactic acid plus probiotic solution. It again has a 2.25 pH, which is important. And again, the conditions and what to expect after treating with this would be lightening of the pigmentation, reduction in redness, firming and tightening and lifting of the skin, detoxifying antibacterial and antimicrobial action. And then we do have what I like to always start my patients off with, which is a little bit lower of a percentage of peel with a little bit higher of a pH, so I can ease their skin into our stronger Youth Boost. This is a self-neutralizing solution of 5% mandelic and 8.8% lactic plus probiotics. Your pH is a 3.5. Again, it's self-neutralizing, the nourishing peel. Again, same things that you're going to expect after this treatment and the same results and benefits, but again, to a softer or more gentle degree. So I think one important thing that I talked about on some of my other webinars, if you've joined me for others, is staying in touch with your clients at this time. Just because we're out of sight doesn't mean we have to be out of mind. Stay in touch with your patients and your clients, send them an email, send them a text, give them a call, send them a snail mail, a note in the mail, and offer them incentives for when this is all over and they return to visit you. Also do virtual consults. If you aren't on Zoom or Teams or GoToWebinars, you should join and you could do virtual or just do it over FaceTime or Facebook video, and you could do a virtual consult with them, check in with them, see how their skin is, give them skincare tips and tricks, absolutely, but even suggest some other healthy tips. Get out and walk for 15 minutes every day. Working in the house is hard when you're not used to it. So those who are now stuck at home working, you know, give them some healthy suggestions on what they can do to stay not just physically balanced, but mentally as well. Also, if they need skincare products, obviously most of you have closed your businesses at this time, offer drop shipping. We are now doing drop shipping for you. So basically you will take the order from your client. You can email it to our customer service. They will fill the order, they will ship the order, free shipping for orders over $50. And then if you don't have a way to charge them, like if you don't have Square or you don't have a credit card machine at home, we can actually charge them and then we can give you the credit for that. So I wanted to mention our April promo, Soothing Essentials Home Care Treatment. It's a 25% off at this time. I know a lot of you aren't ordering retail items right now on stocking up your shelves, but I did want to mention it. Also wanted to invite you to follow us on social media. Follow us, we'll follow you back. Watch for our Instagram live chats. Last Thursday, we had our founders, David and Christine Watson, on. We had a whole hour of chatting with them, and it was so great. But keep an eye out for that and our posts and our specials. Also, our YouTube channel. If you would like to watch this recorded webinar or any others that we have in our library, you can use this link that you see on your screen, which I know it's a lot to write down. If you have your phone near you, take a picture of it, or if you know how to take a screenshot on your computer, take a picture of it. This is the YouTube link. You can also get it after the webinar by either emailing me or customer service. So today, thank you for all attending. I wanted to offer you a special 10% discount. This is great even for your drop shipping. So if you are selling to your clients over the phone or over the computer right now, you will get 10% off the wholesale order that you place for them. And you are charging them retail prices. You know, it's important that we stay alive and we keep our revenues coming in. If you want to pass that 10% off to your client, absolutely do so. That's your choice. That's whatever you want to do. But just for you, the professionals on the phone today, the code that you have to use is GLOW413. That's GLOW 413. You can either email customer service for your orders at cs@glowbiotics.com. It's on your screen right now, cs@glowbiotics.com, or the 800 number is 877-423-1314. I'll repeat it one more time, 877-423-1314. Our sales manager is Tim. Yes, we're all working from home right now, but he is happy to take your call or help you via email. And again, you can also email or call for that YouTube link as well, or email me at education@glowbiotics.com. Once again, I want to thank you all for being here today, taking time out of your busy schedule. I feel really privileged that we have the ability to take this time, and oftentimes we are so busy with patients and clients, we don't have the time to actually further our education and do continuing education. So if one thing or one blessing has come out of this for me as a professional is that now I have a little time on my hands and I'm able to log on and attend webinars and take some time to do some reading and that. So I appreciate that you spent the time with me. I do have a couple questions here that I'm going to go ahead and answer. So if you want to stay on and hear the questions, I'm happy to respond to these. One question is, can you use brightening cream due to hormones? Okay, so I have two questions. Can you use brightening? I think it's the same person. Can you use brightening cream in the groin area due to hormones? Absolutely, you can. Two things. The groin area as well as like under the arms are difficult areas to treat for pigment. Two reasons. Sweat, so that causes heat, that causes inflammation. Also, the rubbing, the irritation. When we have pigment under the arms, 9 times out of 10, it is because as we walk and we swing our arms back and forth, that rubbing under our arms causes that pigmentation. Same in the groin. If you're wearing underwear and it's in the creases, if you are hormones can definitely do it, but sweating in that will do it as well. Now, you have to be very careful. I would not use directly on genitalia, but if you're talking about in the creases of the groin area, absolutely you can use it. I'm going to wait 1 minute here and see if there's any other questions that come through. Okay, let's see here. Is the 10% code good for back bar items as well? Absolutely it is. It's off any order as long as it's not used with another promotional discount. So yes, you can use it on back bar items as well. And then I have another question. Can you use vitamin C in the morning and retinol together? For me, that's very dependent on the how strong the skin is. How if they are reactive, probably not. But if you have someone with very resilient skin, yes, you can mix a little bit of our retinol and a little bit of the vitamin C together, but only in the evening then, right? Because we do not want to use retinol during the day. So my particular way that I would recommend usage, vitamin C in the morning, retinol at night. That's how I would prefer it. Or if you just want to mix them together, then use it for evening time, and that's it. Any other questions coming through? Okay, it doesn't look like it. Once again, thank you all, and thank you for those who stayed till the end. I appreciate it. And I will be giving a webinar next week as well. And I know this is terrible, but I don't have it in front of me, and I don't have the list in front of me. But I definitely we will be putting it on our social media, and we will be sending out emails regarding the email list. And I believe, if I'm not mistaken, when you received your email about this webinar, it had the list of all the other webinars that are going to be giving through the month of April. So that just right there might save me. Thank you all again for attending, and I hope you have a wonderful day.